Thank you so much for your time today, Joe. It's really good to see you again. Could you just start by giving us a bit of a background about who you are, your training, your experience, and
Yes.
where you're working now?
Thank you. Thank you for inviting me. Yes, it's a pleasure to be here. I started my medical career in South Africa, in Johannesburg, where I did my undergraduate training, but moved over to the UK and did all my specialist training in the UK, with the exception of 2 fellowships, one in the United States and one in Canada. And then I was back in the UK, working in London as a consultant ENT surgeon with a special interest in rhinology and nasal plastic surgery. I was there for probably 26 years it was, and then decided to make the move to Dubai.
So why did you choose to work at Mediclinic Hospital in Dubai in particular?
Yes, well, I had 2 interviews in the period that I was looking for a job. The first was with a very small hospital where there was only 3 ENT consultants. One of them left and they were looking for a replacement, but actually they were looking for an ear surgeon. So I interviewed, but it was clear that it wasn't a good fit for me, or probably for them. And then the second interview came along when I was called by Allocation Assist and said, look, we've got this thing with Mediclinic, and you were very enthusiastic about it because you felt that Mediclinic was probably one of the best hospital chains in UAE. And so I thought, fair enough, let's try it. And in fact, behind the scenes, I spoke to 2 of my colleagues who had also worked for Mediclinic, which was really helpful because both of them came up with exactly the same story, in that it was a very good unit, very good group of hospitals. They look after their staff, facilities are great, working conditions are great. And it was interesting because both of them said exactly the same thing independently,
Yes.
which exactly mirrored the enthusiasm that you guys had. So I felt very comfortable in applying for something with Mediclinic because I understood that they had a good reputation and it was a good service to work with.
Yes, absolutely. So how have you found your experience working in the UAE so far compared to other countries?
Well, it's very, very different. It's been a complete mind warp, complete change. And in some ways, it's been fantastic. There's actually relatively fewer intermediate management staff. And the majority of work that I do is managed purely by my personal assistant stroke nurse, whom I work with very closely every day, the same person. And she does everything. She books my cases, she schedules them, she clears it with the insurance companies. She tells me when to be at the unit, what time, whom I'm operating on. So it's fantastic, whereas we didn't have that in the UK, and it's a breath of fresh air. It's fantastic. Yeah. So in that sense, it's very different. The other thing, of course, is that the hospitals here don't really have junior doctors. So you don't have anybody running around doing all the donkey work for you. You have to do everything yourself. Yeah. So you learn to become a lot more self-sufficient, but equally things run a lot smoother because you're doing everything, you understand everything. Yeah. And so it's been very different. And you know, one good thing about doctors is that we're very adaptable. We know how to change to various environments and situations and so on. So anybody coming in is very well supported. The hospital staff are very supportive. They're very encompassing. They're very helpful. And so it's the actual clinical work has actually been a very easy transition.
Yeah. Does the patient mix or the variety of conditions of the patients differ here compared to where you worked previously?
Yeah, absolutely. There's a huge difference. First of all, the population is very young, which I didn't really anticipate until I realized that actually, because 80% of Dubai's population are expats, they come here to work. And then when they finished working and they finished their career, they go back to their home countries. Mm-hmm. So in an average clinic, we don't see many elderly patients. Yeah. Whereas where I worked in the UK, you know, probably 50% of my patients were over the age of 65, 70. Yeah. Here, it's unusual to see anybody who's more than 60.
Yes.
So the population is a very young population. And of course, that affects the disease pattern. So we don't see a lot of the diseases that you would see in the elderly population. Yeah. We see a different type of patient population. And as a result of that, for instance, hearing aids. In the UK, probably 3 or 4 patients in every clinic would be referred to the audiology department for a hearing aid. Yeah. Why? Because they're an elderly population. Here, I don't think I've referred a single patient for a hearing aid in 3 months. Yeah. And that's because the population is very young. Yeah. Similarly, you know, there's a huge differential in population groups here. So we have huge numbers of patients from the Indian subcontinent, huge numbers of patients from the Philippines, massive numbers of Europeans, Russians, all sorts. And so, we're seeing a lot of different patients with different condition predispositions.
Yeah.
So, very different.
Why did you decide to specialize in rhinoplasties? Because you do functional and cosmetic, don't you?
Yes, that's right. Rhinoplasty is an integral part of ENT training. So our junior doctors in the UK get trained in rhinoplasty surgery from a pretty young age. And that is because we see all the functional cases. In other words, by functional, we mean people who can't breathe properly. So we see patients who have had broken noses, who have a deviated septum because it's grown that way. They've got various other congenital malformations and so on. So all of these patients come to ENT. They don't go to plastic surgeons because it's not cosmetic, and cosmetic is not funded and supported on the NHS. So all of these rhinoplasty patients who need rhinoplasties come to ENT. So our juniors from a young age learn how to do rhinoplasty, and I've always been interested in that area. And I was lucky enough to work with some consultants who are real experts in that area, who sort of fired me up when I was a junior trainee. And as a result, I've just followed that through. So I've had a lot of experience in that for many, many years now. So I've been doing rhinoplasties for nearly 30 years.
Wow.
And when you do that, what happens is other doctors who don't do as many, everyone that comes along that's a little more difficult, they would rather refer it to you rather than do it themselves, because it's a difficult case and they're not really happy doing it themselves. So as a result, over the years, I've seen many, many difficult and challenging cases, and that's really helped a lot, because then in the private sector, when you see purely cosmetic cases, they're easy compared to some of the bad reconstructive cases that have had injuries and trauma and things. So it's given me the ability to deal with not just reconstructive and functional cases, but also the cosmetic cases as well. So I've had this sort of dual practice, and that's been the case for many years.
Yeah, well, they're supposed to go hand in hand, isn't it? Even if you're going to have a cosmetic procedure done, it's better to have someone who's got that experience with the functional.
Well, that's right. It's your nose. It's there for a reason. It's there. You've got to breathe through it. You've got to smell. So it's no good looking good if it doesn't work properly. So, this is the reason that rhinoplasty surgeons, rhinologists probably make the best rhinoplasty surgeons, because they're concerned not just with how the nose looks, but how it works as well.
Yeah, exactly. And because you've done so many, like how many rhinoplasties have you done in your career? Like thousands, hundreds? Thousands. And that's why you would be like the best people to go to now in Dubai, I think.
Exactly. And of course, you have to get the message out there, because when you arrive somewhere like this, nobody really knows who you are and so on. But you have to try and get the message across. But once you do, people will then start realizing, and these sort of cases that are difficult and challenging, people will start sending those sort of cases to see me. So I'm looking forward to that.
Yeah, absolutely. What aspects do you find contribute to a better quality of life here in Dubai?
Yes, it's interesting actually. Although I've been on holiday to Dubai a few times, it's very different when you go somewhere to work and live. But Dubai is a fantastic place. It's fabulous. There is so much to do here. The shops and the architecture, the organization of everything is quite amazing actually. And really looking forward to the cooler weather coming, because there's all sorts of outdoor activities. You can certainly play any sports here. There's golf, tennis, cricket, rugby, paddle, whatever you like, water sports, plenty. So there's a lot of things going on here. Thousands of really great restaurants, bars, and fantastic shops and everything. So it's very glitzy and wonderful, but it's the whole vibe. It's very different. Here, and it's very exciting actually. And one of the great things actually was just last week, in actual fact, was the UAE was voted as the safest country in the world. So that's fantastic. It means that women and kids can walk around the streets. That everything is completely safe here, and that's a huge thing actually. Particularly when you look at the situation in some of the Western cities. There's a lot of unrest going on in many of cities, and being completely safe and being able to just walk around even at night with no fear whatsoever, it must be a great thing, I think. And that's really, really something that's worthwhile. But overall, the quality of accommodation here is fantastic. You'll find people that smile at you and acknowledge you in the street. You don't even know them, and it's brilliant. People stand aside, give way, and it's a very respectful society here. Actually, I think you have to respect the Arabic culture,
yes,
because that is quite different, and you need to understand, how they do things and how they think, and as long as you fit in. But I think most people who come here do, and they fit in very well.
Yeah, absolutely. And have you been able to do a lot of networking since you've been here? Have you met, network colleagues?
Yes, networking is a very important aspect of coming here, particularly if you've not been and worked here before, because particularly of referral patterns and things. But the hospital staff generally in the unit that I work in are very supportive and very friendly, very accommodating, and they do have weekly departmental meetings where everybody from the hospital comes together. Somebody presents, and we do it over lunch. We always have a nice lunch. There's always good banter, lots of humor, and you get introduced to various people, and so you do start making these connections and start becoming someone that they are comfortable referring their cases to, which is a really important aspect of expanding your practice here. So I think that's a vital thing. And also, you can get involved in administrative things as well, various panels and things like that, which you don't have to do, but it's certainly one way of increasing your exposure. Similarly, if you have some research interests, you can present those, and once again, that raises your profile as well. There are a number of WhatsApp groups that you can get on, and that way you become familiar with who's around, and you have a presence on there. People start to know who you are. And there are a number of other expat WhatsApp groups as well, where you can join, either British or German or Italian or wherever you happen to come from, who then you can become part of that as well, and they organize events and get-togethers and various things like that. So it takes a bit of time, and I think because everybody here is in the same situation, it's kind of accepted as normal that you go out there and push the envelope, as it were. You have to actually go outside your comfort zone a little bit. But it's not sort of weird. Because everybody does it, and you have to do it because everybody's an expat. So what would be considered a bit sort of cheesy and weird back in Europe here is considered normal, because you've got to do that in order to fit into society.
How have you been able to navigate the regulatory requirements here in UAE?
Yeah, that's another story actually, because that is very, very difficult. There's a lot of stuff you've got to do, and you really need to understand what's required, because that starts even before you start doing interviews and so on. You have to get your Dubai Health Authority DHA registration. You have to apply for that. You have to get all your documentation verified. There's a whole lot of stuff that you have to do. And to be honest, I don't think if I'd known how much there was to do, not only before you come here, but once you get here as well, if I'd known how much there was, I might not have undertaken moving here. But what made all the difference was Allocation Assist. Made a huge difference, because they are experts. They've done this umpteen times. They know exactly what is required and what needs to be done, how to do it, where to do it, when to do it. And that information, they are so helpful in bringing that forward and taking you through the process of negotiating all of this stuff that you have to do, this red tape. And I think without them, I honestly don't think I would have come here. So it made a huge difference to me. But yes, one needs to understand that there is all of this to be done. When you look back on it, you can see the reason for it. And actually, it's one of the reasons why things work so well in the UAE, because it is highly regulated, highly organized, and everybody knows exactly what their situation is, what is expected of them. And so I think it's actually a really good system, but it does take a lot of spade work to get through. And not only that, when you get here, because the way things are done, it's not just the regulatory stuff. It's moving your lifestyle, your quality of your accommodation. All of these things are so different to the way it works in Europe and the UK in particular. You need to know how that works. And once again, Allocation Assist help you with all of that, and they send you really nice information, things that really help you to understand what you've got to do and what's going to be involved.
Oh, thank you so much, Joe. You're so kind. Thank you.